Hello everyone, this is Dr. Neha, your mentor guide for PSM on Unacademy. Welcome to another episode of 3 PSM images in 3 minutes. Before we begin, just a little heads up, on Unacademy we have started an Focus FMG badge just on the 7th of July. So if you want, you can still subscribe to this batch course and learn from your wonderful educators and get ahead in your preparation. You can use my code PSM Live to get a 10% off. Now, what is this first image? Which biomedical waste is disposed in biomedical waste color-coded bag as shown in the photograph? So this is a red colored bag. Do you put soiled waste, sharp waste, urine or anatomical waste in it? So anything which is soiled goes into a soiled waste, goes into a yellow color bag, like soiled cotton swabs, soiled gauze pieces, all those things. Sharp waste goes into a white color bag. Any type of anatomical waste, human anatomical waste also goes into yellow color bag. So the correct answer to this is urine. How can you remember this? Urine bag jab hum log bolte hain, when we say it has the word R in it. So R for red. Okay, so at the same time, this is a blood bag. Okay, they can ask you, where does a blood bag go? So what is the irony? That blood is red in color, but this blood bag is going into a yellow color bag. All right, urine has the word R in it. It goes into red, but blood bag is red in color, but it's going into the yellow color bag. All right. Yes, this is a picture of urine bag. So urine bag or a Euro bag goes into a red color bag. Remember, R for R. Next one, guys. One question from communicable disease. What do you think this child is suffering from? What is this? So if you look at this, you can see superficial rashes with an area of inflammation around it. So whenever you have area of inflammation with a superficial rash, this is what? This is, look over here also, the area of inflammation present. This is none other than chickenpox rash. Now, how can you distinguish between a chickenpox and a smallpox rash? Very, very important question. Ye dekho. This child, it looks like the thing has been deep-seated. The rashes are deep-seated. This is your smallpox rash. Okay, there is no area of inflammation around the rash. There is no area of inflammation around. Okay, so I'll just show you a comparative figure. Can you see this? Smallpox rash is deep seated. It's not superficial, deep seated. No area of inflammation around. Okay, that's how you will distinguish. And when you talk about chickenpox rash, it's superficial. All right, it's superficial with what? With an area of inflammation around. This is very, very important. So we'll just go through the differences. Chickenpox rash is superficial, unilocular, dewdrop appearance. Pleomorphism matlab the different stage, papule, macules, papules, vesicles, all can occur simultaneously. Inflamed area is present around the rash. This is very important. Smallpox deep seated hota hai, multilocular, umbilicated, only one stage at one time, and to distinguish from chickenpox, no inflamed area around the rash. You could also be asked this picture. If you look at smallpox, what is this distribution of rash? This is known as centrifugal distribution, away from the trunk. This is what? This is towards the trunk. So this is centripetal in distribution, not towards the periphery, but towards the center. Here the distribution is towards the periphery. All right. Okay. Coming to one more image for the day. What do you think this statistical diagram is? This is a histogram. How do we know this is a histogram? There are no gaps in between, and histogram is used to represent continuous data. So they can ask you, is it for discrete or continuous? It is continuous data, quantitative. All right, how will you know? Like we have to represent height, weight, hemoglobin. So they can take up many possible values. Weight can be 20 kg, 20.1 kg. So it's like a continuous thing. So this is a histogram. Now what is this? If I draw the midpoints of this histogram, this becomes a frequency polygon. So frequency polygon is constructed above a histogram by joining the midpoints. Look at this just for your revision. This is what? These are the different types of bar graphs, which are used to represent qualitative discrete variables, like those which can take up fewer values and no in between values. Like over here, does somebody like comedy, action, romance, drama? So it's like it will take up fewer values. You cannot lie between comedy and action. So this over here is a simple bar diagram. This one over here is a multiple bar diagram. All right, and this one over here is divided into different components. So this one is a component bar diagram. Is that okay? So I hope you understood today's class. I will come again with another episode. Thank you so much.